Hi, this is the NRG Clinic intro video. We are a hormone optimization company. This video covers our services, our medications, common questions that we get about our process and labs, and how to get started. Who do we serve? We serve men and women starting from ages of about 30 and up. This is when patients may start to notice low energy, declining sexual health, or they're just noticing they're getting a bit older and they're curious what their hormone levels are looking like. So we have men's HRT, women's HRT, weight loss products, performance peptides, sexual health medications, hair loss medications, skin cream, and longevity medication. For the HRT medications, the most popular here, testosterone injections, testosterone cypionate specifically, testosterone creams, oral testosterone, and clomiphene clomid. These are most popular and trending for patients 30 to 45, patients who are trying to maintain fertility. And then we have ancillary medications for estrogen management like anastrozole or fertility medications like gonadorelin or HCG. During the consult, our nurses walk through with our patients to answer questions and figure out which medication might be the best fit for each patient. Our process first is to sign you up for a blood test at LabCorp. Every patient across the country has a LabCorp within a few miles from them. They're able to walk in or set an appointment. Once those results are in, they'll do an online consultation with the nurse to talk about the results and go and answer questions about medications. If the patient chooses to move forward with a prescription, the medications are delivered to you. And then from that point, the patient will have follow-up monitoring, sometimes every 6 months or 1 year, depending on what their labs look like. For the initial HRT lab test for men, it covers these panels. There's about 44 biomarkers, and for the women's panel, it includes these plus progesterone, and theirs also includes a consult that's a little bit longer. These tests are a combination of safety biomarkers, so the PSA, prolactin, CBC, CMP, lipid. These are to determine if treatment's safe for you, and the diagnostic markers, free and total testosterone, estradiol, SHBG, FSH, LH, thyroid. These are to help determine what type of medication might be best and what dosage. So a lot of questions that patients ask us are regarding, finger prick tests. So maybe they saw another company offer that. A lot of nurses, and we wrote an article about this, don't think that they're very accurate. And patients do have a tough time drawing blood out of their finger and getting enough to do the sample. There's a high rejection rate of those, and it ends up not being as convenient and or as cheap as it should be for a paper test that comes to your house. Other times patients ask us about insurance-based tests. We do have articles about this as well, about what patients do. And what most patients do is they submit their receipt to insurance for reimbursement. If you go straight to an insurance-based provider, a lot of times that bill will be inflated, and then the patient's stuck with copays, deductibles, out-of-pocket expenses, or it's a minimal test. It doesn't cover all of the items to determine the right dosage or the right medication. And we just find that our lab tests are generally a more competitive price than what our patients normally find online. A little bit about us. We have great Google reviews. We do have a small experienced team. We're not, across the country with 10,000 patients. We find that our patients do need, especially for HRT, they do need a little bit more attention. They need to be able to reach their clinician. There are sometimes questions or side effects that they need to get handled. And our reviews show that we really look to provide exceptional care for our patients. And we look for exceptionally experienced clinicians, people who have a lot of experience in HRT. So when our patients have specific type of issues, it's something that they've seen before, and it's something that they know how to treat. And here's what our patients say about treatment with us. So 83% of the patients believe that their health has improved in a 6-month survey that we've done with them. 82% of patients felt that the prices were better than competitors. 94% thought that we treated safety as a high priority. And 82% said that our staff, our customer service team, our medical teams were very responsive to their questions or orders and things like that. And one of the most impressive ones here is that over 80% of patients surveyed at the 6-month mark, um, and over 60% of patients here said that they look and feel better at 6 months. So you can see here that at the 6 months mark, we have feeling and looking better, mental health has improved, better sex life, even work performance for almost 50% of patients. So how to get started, we'll provide the links. You can either talk to somebody at the intake team to go through the process and get you signed up, or you can take the quiz to register for the lab test. Once you've paid, we'll get you registered for a portal, so that way you have a way to receive your results, and then you'll be able to go to the lab. Usually, we're able to issue the lab recs within 1 business day. So as soon as that's out, we just need a little bit of time to get the lab rec to you, and you'll get instructions for when you can go and how quickly you can go. The lab test does require a fasting, so usually if a patient pays or gets signed up on one day, they can go the very next day. Okay, thank you.